Good morning, Kathy.
Good morning, Anthony.
Thanks for joining us today.
Yeah, well, thank you for asking me.
I know that everyone that tunes in this morning and when we share this will get a lot of great info from you. And, sorry, one second.
Okay.
Could you hear that, Kathy, that reverb? No. All right. I'm recording this and sharing it on our YouTube channel and on Facebook. So it had started playing in my ear on delay. So I apologize.
By the way, you back to normal?
I'm back to normal. I had a little bout of COVID. It was maybe 4 days of flu-like symptoms, but I felt the Moderna working in me and came out all right.
Good.
It went around the house, but everyone in my family was great. Unfortunately, we know that, and maybe we can discuss a bit, that COVID hasn't disappeared in any way. And I was checking out the news this morning from Singapore and China and other parts of the world where COVID continues to spread as temperatures and the environment change. And I didn't hear anything about that in the election last night. In the debate last night. So maybe we can talk a bit about that as well. We'll get going right at 10 o'clock. Welcome to everyone who's logging in right now. This is a webinar format, so you're not being seen or heard right now, but I'm going to invite you to send us a question in the Q&A. No, pardon me, let's use the chat box. Send us a question in the chat box, and if you want to come on screen and speak to us, state your point of view on the candidates thus far, on what you heard during the debate last night, what you didn't hear during the debate last night. The idea is for us to have the kind of conversation you would have around the water cooler if everybody was coming into the office on a Tuesday morning. Or in our case, I'm glad to be back in the office part-time, but we haven't had that opportunity for those of us still in the workforce for a number of years now. So I thought we could do a virtual water cooler chat and just get a sense and also talk about those top issues, the CARP 5 that we're looking to impress upon all the candidates across the province, particularly the leaders, and ensure that they're not avoiding those top 5 CARP 5 issues that seemingly last night they endeavored to avoid. So we'll dig into it right at 10 o'clock. So Kathy, I see your camera is working well and your audio was fine. So we'll maybe you could just mute and turn off your camera and we'll see you right at 10.
Great.
Thank you. As you're joining us, I'll invite you to practice using the chat function of your Zoom account and just let us know that you're here and where you're looking in from. We will encourage you to ask some leading questions in the chat box for us to discuss. And if you're interested in sharing your point of view on camera via audio and video, I will bring you into the video discussion as well. This is an informal conversation, a water cooler chat about what we heard from the election debate last night in Ontario, what the leaders had to say and perhaps what they didn't have to say. So let's discuss that in a few minutes, hear from you what you're hearing in your ridings across the province. Are the candidates knocking on your door? Are you talking to them about CARP's issues? What other issues might be on your mind? Are you being distracted by issues like highways and affordability? Have they creeped into your consciousness during the campaign's efforts to make those the top issues, while CARP is working very hard to ensure that our issues are top of mind for all the candidates. But we'll get started in 5 minutes. And thank you very much, everyone, for joining us this morning. And as you're logging in, please do click on the chat box and let us know where you're looking in from. I see that Bev Buchanan has joined us from the Greater Bay of Quinte CARP chapter, also known as our BBQ chapter. Bev, I'd like to bring you on to the screen. If you're ready, let me know in the chat box if that's okay, and we'll bring you on to hear from you and what's happening in that part of the province. If there are other chapter reps online who would like to join us in the initial part of the conversation, we'd love to have our volunteers lead the discussion. I see Carl Marshall is here, and Doreen. And there's Bev joining us now. Terrific. Good morning. I'll start recording this. We're going to share this discussion on our carp.ca/carp5 website shortly after we're finished today. And I'll welcome everyone who's just logging in now as we come to the top of the hour. We invite you to listen in to this webinar, and if you're interested in speaking, being seen, and being heard during our conversation, please indicate that in the chat box or raise your hand using the hand symbol in the toolbar at the bottom of your screen, and that'll indicate that you would like to add a comment, and we'd love to have your feedback as well. And there is my colleague, David Kravitz, Chief Membership Officer at CARP. Welcome, David.
Hi, Anthony. Hi, everybody. You hearing me okay?
We can hear you terrific. Thank you. And a reminder as you're coming on, welcome everyone this morning to our water cooler webinar, where we're discussing what we heard or we didn't hear from our candidates running for Premier in the Ontario election in last night's debate. As you're logging in, please do say hello in the chat box. Let us know what town you're looking in from, what riding perhaps. And if you would like to join the conversation once we get started, send us a note in the chat box or raise your hand, and we'll include you in the conversation. And I'm going to put this on gallery so we see everybody. And Kathy, you're welcome to turn on your camera now and join us. Good morning, Bev. Oh, got you on mute there.
Good morning.
This is Bev Buchanan. She's the volunteer president of the CARP chapter in the Greater Bay of Quinte, Ontario, also known as the BBQ chapter.
One of the most beautiful spots in Ontario.
No doubt about that. No doubt about that. Although Kathy may be arguing from Ottawa this time of year. It's lovely. The tulips are up and the canal is flowing. So welcome, Kathy, from the Ottawa CARP chapter. And David Kravitz is, again, the Chief Membership Officer at CARP. I'm Anthony Quinn, the Chief Community Officer, and taking on the role of our election lead for the CARP campaign, as we are doing our best to keep all of the candidates across the province, and particularly the leaders, accountable and focused on our top priority issues during the campaign. So we have reached 10 a.m. I welcome everyone. We've got just about 100 people on the line, so that's a wonderful water cooler conversation, and let's get started. I wanted to start off by saying that CARP has assembled 5 key issues that we are labeling the CARP 5. And those issues are priorities for our members in that they are the most pressing, most timely, and almost crisis issues that have been kicked down the road for so long that politicians seem to get away without talking about them during the election campaign. And when we always endeavor to hold them responsible for these issues, we get 5-year and 10-year plans. So maybe I'll just quickly list off the CARP 5 issues. We'll talk about what we heard regarding them in the debate last night, and then hear from our panelists here and you tuning in. So the first, not necessarily in priority order, but funding better home care is the number one CARP 5 issue. Transforming long-term care is the second one. When we talk about transforming long-term care, I'm going to ask Kathy in Ottawa to help us explain what we mean by transformation. Drastically cutting wait times is the third issue. David Kravitz will give us some background on our Fix Healthcare Now campaign that was waylaid by the pandemic 2 years ago, but the issues are even more pressing now as we're coming hopefully out of the pandemic. And then we've got 2 issues that we're calling preventative issues. We're looking to prevent disease by making vaccines more accessible, and we're looking to prevent decline in healthcare by making and funding access to fitness for seniors. So those are the top 5 issues, the CARP 5. And I wanted to ask Kathy first from the Ottawa chapter about the priority number 2, not necessarily a second most important, but transforming long-term care. We hear candidates talking about funding thousands of long-term care beds. They're promising an increase in staff, but no one's talking about what CARP is hoping to impress upon all the candidates, that long-term care needs a transformation, not just more of the same. Kathy, can you tell us what the Ottawa chapter has been up to over recent years regarding transformation and what we're pressing for in this campaign? Kathy, you're on mute.
Sorry about that. Thanks, Anthony. Good morning, everyone. Well, we know that over the last 2 years, most Ontarians heard loudly and clearly that the long-term care home system was broken, and that, in fact, it had been broken for 3 decades, possibly 4 decades. And then after 2 years of the horrific tragedies, our political leaders all said, we can never let this happen again. Well, it will happen again if we don't fix it now. So, as Anthony mentioned, CARP's priority is to bring a complete transformative culture change to Ontario's long-term care homes, from a task-based to an emotion-based model of care. And what that means is putting the focus on the resident and not on the task. It means setting up smaller home-like environments for the residents where they're treated with compassion and respect, and where they can find joy in living until they die. In other words, a complete shift away from the current institutional setting to an environment that looks, feels, and operates as a home. It means recognizing families and caregivers as integral members of the team. It means staff who are trained in empathy, have full-time work with adequate salaries and benefits. And this emotion-based care has already taken hold, although very slowly, in Ontario and other parts of Canada. There are a growing number of homes right here in Ontario right now. And these homes, there are 4 homes that we know of that have already embraced this kind of care: the Eden Alternative, the Butterfly Model, the Greenhouse Project, and the Hojwe Village Model. And some of these homes have been operating successfully, the ones outside of Canada, for up to 20 years. So where has Ontario been? So the homes in Ontario that have managed to do this within regulatory and financial constraints. So it is being done. So it can be done. And there's a mix of ownership, interestingly enough, of these homes in Ontario. There are some municipally owned and operated, some not-for-profit charitable, as well as some private family-run operations. So to us, and I think that we've kind of agreed as an organization that really it's not so much the ownership that matters, but it's the kind of care that really, really matters.
Kathy, when they talk about ownership, that's one issue, but does that get them off the hook for talking about the transformation that we are talking about? We hear 3 of the 4 parties saying we will change the ownership model, but they're not talking about changing the method of delivering care. Are we letting them off the hook by saying privatization is the big issue?
Well, I think so. And I think we can't really paint all the private homes with the same brush. I think that's the issue. And if we look at the recommendation of the commission, they had a potential solution of how to deal with some of the issues that came up in the private homes. And of course, we know now that a lot of these recommendations have not been implemented. And by the way, I've just realized as well recently that one of the key recommendations was that the government report after 1 year of how they've implemented some of the recommendations. And to my knowledge, I don't think anybody's heard anything about that kind of accountability, which is very disappointing.
And Kathy, you come here as an expert. You had a career in leadership in the Alzheimer's Society. What is the experiential difference for a resident of a long-term care home who's in the traditional institution versus a butterfly model? What is the experience of the resident, and how different is it, and why are we advocating for it so making it such a priority for our members to change this?
Well, I think, as I mentioned, that the focus of care in the homes, not just the butterfly, but the other 3 homes as well, the focus of care is on the resident. It's not on the task. So the residents feel that they're living in more of a home-like environment where the staff gets to know the resident. They know who the residents are, maybe who their family are, what their occupation was in life. And they also provide meaningful activities that would be suitable for that particular resident. So the residents, one of the benefits of these homes, they have shown there's a much greater resident engagement, so that they can, they should be having some fun and some joy in their lives. And this is what's being provided in these new models. They're not just sitting in front of a TV because the staff don't have time to spend with them.
There's a great video that the Toronto Star reporter Moira Welsh put together that featured the butterfly, I believe it's a butterfly model in the long-term care home in Malton, Ontario, in the Peel region. So I'd encourage you to visit the CARP.ca website and just see what that transformation looks like from the patient point of view. I think it is night and day from what those homes that have not transitioned, have the transformation, are experiencing.
And some of the benefits that are mentioned in that video and came out from that first year in Malton Village, which was quite remarkable. One of the major ones was reduced staff sick time. And I don't have current figures, but that first year they experienced 75% fewer staff sick days, which is remarkable and obviously results in huge staff savings. When staff are off sick, I know that it's just a huge budget line item. There also were reduced level of antipsychotic drugs, reduced level of supplements, reduction in food waste, less depression, and as I mentioned, certainly an increase in resident engagement and satisfaction from families and staff. So the benefits are quite clear.
As you've been talking to candidates during the campaign and previous to that, Kathy, and even at the CARP annual general meeting, we had the then Premier Doug Ford say he gets it and he thinks it should be transformed. What are you hearing on the campaign trail from your candidates, and is there a commitment to change?
Well, I have to say that it seems that the focus has shifted away in the candidates from the candidates' radar. They talk more about home care, and they talk more about certainly now affordability and as you had mentioned earlier. So I think unfortunately long-term care has dropped from their screen quite a bit, and so I think we have to do something to try and get it back in play.
Maybe David, I'll ask you to weigh in here. We are doing our best at CARP to be thought leaders during the campaign to make sure that politicians don't get away with distractions and are talking about issues that are affecting voters, Ontarians today, not projects that are billions of dollars in 20 years down the road. How is CARP keeping that on the radar, and what should we be directing our members to be doing to ensure that it stays on the campaign radar?
I think just to lead off, I want to just refer back to last night's debate. I assume everybody saw it, or most people saw it. It perfectly encapsulates what the problem is. Because to be fair to the party leaders, you've got 1 minute to talk, 45 seconds to rebut. Then you're on to the next topic. There's 5 different topics. The moderators could be skillful or less so. I thought my own opinion was they were very poor last night. But so you're going to take these complex questions that have been years in the making, and you're trying, if you're a party leader, if you're Horwath or Ford or Del Duca or Schreiner, a quick soundbite, something that's going to be in the paper tomorrow. So you're bound to oversimplify. You're throwing around a lot of facts and figures, and there's really no opportunity to dig into it. So our goal during this campaign, and I think everybody should try to, I think we should try to keep this in mind, is that we want to get markers down. We want them to say publicly certain things that we can then hold them accountable for. Because if you look at the traps that we're all in if we're not careful, and it's one that the politicians, and I've been hanging around CARP in one capacity or another for more than 15 years, they are geniuses, all of them, at saying the right thing. You're never going to hear a politician say, I don't care about healthcare. I don't care about health. I don't care if seniors die. And they're not going to, they all know what to say. Yes, they care about seniors. Yes, we should retire in dignity. Yes, this is the generation that did so much. Yes, this is compatible. Everybody's got the speeches already written. So they're all going to say pretty much the same thing, and it's all going to be what we want to hear. They're all going to, we're getting killed by statements of good intent. Nobody's got bad intent here. The question is, are they going to commit to an action that can be measured and that they can be held accountable for delivering results? And I think the devastating thing that they faced with COVID, and I say this would have been true with Ford as premier or Del Duca or any premier, was those hard numbers. Look how many people died. Canada had the worst record in the world. 88% of the deaths were among seniors in care homes. I think, Anthony, 65% of Spain, where they were the second worst in the world. So there's no hiding from that. So what we're trying to do on healthcare is we're trying to make sure there's no place to hide. The second thing we're trying to do is move them very, very quickly from statements of good intent to how are you going to do it? How are you willing to be measured? When's it going to happen? And are you going to be held accountable? And a great example of that was last night. They were all so glib. I mean, increased funding. Well, Canada already spends near the top of all the OECD countries on healthcare. We're going to put more. We're going to spend $2 billion more. Oh, all this time, everything would have been good if only we had spent $2 billion more. Are you kidding? So it's these quick and dirty answers. And to be fair to them, in a debate where you've got, the other thing is, and I want to be careful here, but these slogans can distract from the real problem. So we heard a lot last night in the debate, privatize, and we should privatize it. Okay? Well, I mean, if Andrea Horvath was one of the screens on here during this, I'd say, okay, let's get rid of 626 long-term care homes in Ontario, and about 350 of them, 400 of them are privately owned, and the rest are. I mean, so let's take all the private people out tomorrow morning. Tomorrow morning, no more private homes. Where are those people going to go? Now you're going to buy out the private owners, going to get them out of the business. So obviously you're not going to throw the people out on the street. So you've got these private homes, you've got to transition, you've got to move from A to B. Now you're going to, so you're not going to throw the people out and have them sitting in the parking lot suddenly. So now, okay, no, I'm going to take over the home. Here's your check. And Del Duca wants to do that. Estimates 5 billion, 10 billion, some people say 12 billion, write them a check, take them out. Okay, well, you write them a check, you take them out of the business. Now you've spent X billion dollars, you haven't added one bed. All you've done is put the money into their pockets so you can now run that crumbling home that needs fixing. So it's not as simple as it looks. And that's why I'm saying, and I'm not advocating one or the other ideologically, but it's complicated. It needs top-notch managerial competence and standards and goals and targets that can be measured and that they can be held accountable for. And that's really why we've come out with the CARP 5 to say, I want to get you on the record as supporting this. Then I can come back to you at the next election and say, remember when you were fishing for votes and you were making all these promises? You said you were going to do this, you didn't do it. And so sooner or later, we've got to hold them accountable.
David, if one
Sorry
of the
for that long-winded answer.
It's really important. If one of the three parties that were in the debate last night who claim that they will remove privatization or private companies from providing long-term care service, if one of those parties are elected, that doesn't change our demand for transformation. So the transformation that Kathy talked about can go hand in hand with private or public fund. We don't have an immediate need for that change. But are they avoiding, David? Are they avoiding the issue of people lingering in long-term care and dying in greater numbers than they should?
Of course they are, because they have to, because they dare not look. At least two, I'm going by memory here, so don't hold, but at least two of the homes that the Army had to move into at the very beginning when there was a disaster, at least two of them were not-for-profit homes. I think maybe
if we look at Quebec next door,
about what happens inside the home. Now, if you want to say ideologically that private companies should not own long-term care homes, I'm not even opposing that. I'm simply saying right now they do. So you got to get them out. How much is that going to cost? How long is it going to take? What's going to happen to the people living there in the meantime? Who's going to build the new beds? Are private companies going to build the new beds? Well, they already do. All the hospitals that you're building, the actual building of the bricks and mortar, those are done by private companies that the government is paying. Fair enough. Unless somebody's saying, no, we shouldn't be any private construction companies. So it's complicated. And unfortunately, a debate such as we had last night lends itself to quick and dirty sloganeering and 30-second sound bites, and which is fine. I don't think you can fault the leaders for, responding to the format that they were given, but we can't sit still for that past June 2nd. We've got to say, all right, that's all cute, but what are you actually going to do? What'll it look like in 6 months? What'll it look like in a year? What'll it look like in 2 years? And if they can't tell us, don't vote for them.
Well, there's 2 weeks and 2 days to election day, David. I think there's still time for Zoomer voters, for CARP members, for this. I think the number we came up with, David, was 3.6 million voters in Ontario over the age of 60. Add another million if you go a little younger. So that powerhouse voting block, we've got 2 more weeks to really insist that they look at this CARP 5 and not wait till after there's an election and say, well, I have a mandate not to do something because I didn't talk about it. Bev, you had your hand up. I thank you. So can you let us know what you're thinking out in the Quinte area? You're back. Yeah.
I want to say how impressed I am with what the Ottawa chapter has done. And Kathy, you've just really been exemplary in this whole discussion. I guess I worked in healthcare for 50 years, a variety of things. The last 27 years in the CCAC home care, and the last 5 years of that was making bed offers, so connecting with long-term care homes in this area and other areas. My feeling with the points that you made, Kathy, is to maybe just sort of end with others that have been made, is to simplify a little bit. What I've read in the documentation is that there's a reduction in the psychotropic medications being used with patients. So that indicates happier residents. There's reduced sick time. So that indicates happier staff. There's increased spending because of the previous two issues. So that should mean happier management and owners or whatever. What's to argue? You know, it's not a matter. It's not a matter of more spending. It's not a matter of building more big institutions. That's the point. Institutionalizing our elders who want to continue to live a thriving life. I do. I don't know, really. So I don't know what the argument is.
No, Bev, you participated in the system, the infrastructure of how it works, as did Kathy, and the work that the care workers, the nurses, the PSWs, the employees of the long-term care homes, the work that they're doing is not what CARP is focusing on. It's the models. But I believe that in Ontario, as a group, we are embarrassed of the system that we have in long-term care. We are ashamed of what our current residents are going through in many cases, not the workers, but what the situation that our loved ones find themselves in. And it is an embarrassment that this is all we have to offer those who need 24-hour care as part of our healthcare system. So this transformation applies to a relatively small portion of our demographic who will need long-term care, but it is a blight, or David, what's the right term I should use for a system we're ashamed of, but we're pumping billions of dollars into it.
Well, I'll share one observation with the group, and it's a disturbing one, and I apologize, but we had a episode of the Zoomer, the TV show, where we have panels that discuss things, and I was on a recent one that talked about aging in place or living in place or living at home, and one of the experts on the show was from the Baycrest Health Sciences Gerontological Hospital, and a fantastic resource here in Toronto, which has a big aging at home program. And she said that in coming decades, we will look back on what happened to seniors in our nursing home the way we look at what happened in the residential schools. That's how shocking she found it. So take that.
Yeah, that's.
I mean, it's a very disturbing imagery, but she actually thought that it was like complete neglect. So anyway.
Okay, well, let's get back to the topic at hand, David. In the election last night, the debate last night, I counted 13 different topics. It went from affordability to Highway 413 to housing affordability, quickly brushed over healthcare, pandemic healthcare lessons learned, if there were any, and then education and violence, hate crimes, climate change, and any regrets that the candidates may have had in their political careers. I didn't see any depth. You mentioned the downside of the format, perhaps, but is it up to the media, the moderators, to pick things that are most pressing for the most voters, or are they trying to check every box? What did you see, David, in the performance of each of the candidates, and who may have actually hit on what CARP's talking about?
I think the programs are trying to. There's no way I ever expected this debate to only be about healthcare, or they would have announced that it's the healthcare debate. They have an hour and a half to touch on all the different issues that they think matter the most. And then the leaders can try to shoehorn their things in. I think it's an unfortunate format because it every topic gets kissed off in a few sound bites. The other thing I think we should think about, and I really want to hear from our participants who you thought won the debate, but we also have to recognize that the goals of the leaders in the debate is to further their own cause on the election. And therefore, the winner of the debate may not be a person who defeated the others. It may be someone who holds serve. I think my own feeling is that Doug Ford held serve, and that's not meaning that I like Ford or would vote for Ford or I like Doug. Just who did what they were supposed to do. I think that under those criteria, Horvath probably lost ground, in my view. Others may violently disagree. Schreiner looked good. I thought he had a great play at the end that he should have used throughout the whole thing, which is let's just have more greens in Queen's Park. And I think every time he talked as if, when I'm premier, I'm going to do this. Well, come on, you're not going to be. He would have been smarter to say right at the beginning, I'm here to tell you, give me 5 members and I'll be happy. Stir it up a bit, get some disturbers in there at Queen's Park. That would have been, I think, shrewd. Horvath had to attack Del Duca because she's really fighting for second place, and Ford was happy to sit back like the Cheshire Cat and kind of smile and say his prepared stuff and not really look terrible. So I think everybody kind of did okay. I thought that the one person that didn't do maybe what they wanted all the way was Horvath, but she had two goals there, and it's hard to achieve that. But that's just me. But I'd like to hear. I don't see any. I had no hopes for healthcare dominating the debate at all, and I was disappointed by how shallow healthcare was. But then I thought everything was shallow.
Yeah, it's the biggest part. It's the biggest part of
Yeah.
Ontario's budget. It affects everyone, and it affects our members perhaps more acutely as they age. And as you mentioned, David, we're investing, the right amount of money according to international standards, but not getting the results.
One last thing real quick on the Zoomer issue. I'll just throw in case anybody, I might have been the only one that noticed it, and it's certainly not going to change the outcome. But I thought Horvath made an unforced error when she attacked kids living in their parents' homes. That's a decision that some families are making eyes wide open. She positioned it as always bad for the parents, bad for the kids. And I know many families that are now creating intergenerational homes. It's a response to the cost of housing, but it's not. I wouldn't have characterized it as something bad. I don't think everybody got really angry with it, but I think it was a needless slip up by her.
Yeah, and David, maybe, and I'll ask Bev and Kathy about affordability on this, but if the housing affordability is a big issue for a young family demographic, does that necessarily mean that older adults who have gained some equity in their homes should be campaigning to have the value of their homes reduced? So that's, David, you're the expert in the generational warfares that are waged sometimes, but should CARP members be concerned that government policy could reduce the value of their homes? Oh, I think David froze there.
Sure, of course.
Oh, yeah.
Well, why do you want it to be worth less than it is today? I mean, how big a hit are you going to take for the generation? But it's a complex topic. But I think she just made a mistake in saying it's bad for multi-generational setups are bad, and I don't know why it follows automatically that they're always bad.
No, and I just wonder if they're setting up more of a conflict between homeowners and an upcoming generation who are finding homes to be expensive, unattainable.
But frankly, the whole thing was a conflict. And attacking Highway 413, they're saying if you live in that area and you're stuck in traffic and you want a new highway, too bad, you don't get it. So there's a group that wants it. There's a group that doesn't want it. There's a big Uber story here about the Conservatives versus downtown Toronto. That's an old theme, where his votes are and where the other party's votes are. You can't expect it to work itself out evenly. I thought everybody did. It was kind of a blah for me, but I don't think anybody really, did terribly. But I don't think there was all Ford had to do was not get slaughtered, and I think he kind of achieved that for himself.
Kathy and Bev, you're welcome to weigh in anytime. Don't have to put your hands up. Go ahead, Bev.
Kathy, you were first. Have you got something to say?
Okay.
Well, I just wondered how many people listened to some of the debrief on TVO yesterday with Steve Paikin and some of his people. He was his strategists from the different parties, because he mentioned, which I thought was quite shocking, that Ford managed to get in with his binder. And apparently that's against the rules. And so, but I don't know why they let him do it. And so maybe that's why he seemed more relaxed, because and you could see sometimes he had his talking notes. And I guess so I found that very peculiar that they allowed him to get away with that. But one thing I did want to mention just before I forget, Anthony, is that we've been having great difficulty reaching candidates here in Ottawa. They seem to have a policy of maybe no response. We've sent out emails we have 8 ridings in Ottawa, so we're trying to reach and meet with 24 candidates. And we've sent emails out to almost all of them. And I think, to my knowledge now, we've only managed to get 3 meetings. And several of the people they've either said, a couple of the candidates, the incumbents, have actually said they just don't have time to meet. But if they get reelected, they'd be happy to meet with us then.
Is there a trend amongst which parties are not responding?
Well, I would say maybe mostly the Conservatives, but I'm not sure, because we're not getting the response from the others either. So maybe that's not fair to say. I would say it's pretty much across the board.
And
It seems to be incumbents versus not. The incumbents are all indifferent, right?
Yes, but even I think what's happening is some of the new people, and maybe more, who are maybe they're younger and more inexperienced. Maybe they don't have campaign people or offices yet. I don't know, but some of them, we just don't get a response at all. And we can't find anything on the Riding Association website. So it's quite peculiar.
Yeah.
Bev, are you hearing the same thing as you're trying to get in touch with candidates?
We're just starting for the federal campaign because of the pandemic and our population age. We met in outside locations. One favorite was the Rose Garden here in Belleville. And so we are duplicating that approach. We had a really good response for that federal campaign, and lots of good, really media following. So we're doing the same setup this time, and we have just started contacting 6 parties that are supposedly in our local area. We have not been able to get any information on, on the Ontario party, unknown to anyone, although we have a name, that's it. And we have actually confirmed participation for 3. So there's just 2 that we have to confirm, and that's Todd's, the Conservative and NDP. So Todd Smith's office sounded like he was incredibly busy, but we said we would be flexible with our schedule. So we're in the same process, Kathy.
I'll tell you, in the national office, I've spoken with Andrea Horvath's office. I had an appointment set, but I was down with COVID and I couldn't get to her office that week. We're trying to reschedule, so they're on our radar. I did speak to Derek Sloan yesterday, the leader of the Upstart Ontario Party. The New Blue Party is another, I would say, alternative, conservative-leaning party that is in contact with us. Mr. Ford's office has been silent with the national office, and I'm working on Mr. Del Duca's team, who is trying to find time for us, and I'm speaking with Mr. Schreiner tomorrow. So we're getting a bit of the same, and I'm not certain if there is and David, you're the marketing guy in the room, if there's a tactic to that, and there has been in the past, where if the candidate doesn't say anything, they can't mess up.
Can I interject here?
Yes,
we in the past had a situation where we were inviting the candidates in. The Conservative member was the only one that did not show up for the debate. One of our members, board members, placed the name of that candidate on the table in front of a glass of water and an empty chair. That was picked up beautifully by the media.
Well, that's good because they might do
yeah, sorry.
I was going to say they might do the calculation that if there's 150 people in the room and they don't show up,
Yes.
that's not going to hurt them. But if it's in the newspaper that they didn't show up, that's
Did they respond after it was picked up by the media?
We heard from him very quickly.
I bet you did.
Now we are trying to figure out something comparable for this outside location.
What did he say? But what did the candidate say when it was in the media?
I wasn't involved. I don't have the
Okay.
particulars.
So
but
I have
it
a
was
request.
turnaround.
I have a request, and we have 2 more Mondays to go until I'm on with Bill Van Gorder on Libby Znaimer's show, Fight Back with Libby Znaimer on AM 740 every Monday at noon. And we're talking about the election. And I think it would be kind of fun. I don't mean that in a frivolous way. It's the wrong word. But if you guys, both Bev and Kathy and everybody else listening, because I'm seeing some comments on the side, we had a drop in and nobody came in. And if you could email me the details of who didn't show up and what, we had a meeting on the thing, and I'll mention this on the radio. And then the next time Libby talks to one of the parties, maybe we can get somebody or we can release it to the media, and let's embarrass the bejeebies out of these candidates and make them explain why they didn't come. That's the way you got to do it, though. You can't we are lucky at CARP in that we have a media channel that we can get to, and let's name and shame if they didn't come. I'm seeing some comments in the chat here that in some cases they didn't even reply. They just didn't show up. It's one thing to say I've double booked that night. I'm so sorry. When can we do it a different time? It's something to,
Well, the other thing,
happen.
David,
But no attendance, no nothing.
Yeah.
Let's name them. Send me the names. Send me the names.
David, one of the other things that we will be planning, as we have done before, following the election, we will be planning a meet and greet the new representatives. So letting them know that ahead of time, that they're going to have to face the crowd at the end of the process.
David, last night, the Barrie area chapter, Springwater, Medante, I think that's the 2 ridings, they held a all candidates meeting, a fireside chat. It sort of timed with the provincial debate, and I'll get a report from you today on who showed and who didn't show there. And I know that the Sudbury chapter is also hosting an event this week, and we'll see who has turned up there.
Yep. Worst cases, I mentioned some of them on the radio, and we'll send you an audio clip, and you can send that to the candidates and say, "How'd you like this?" If we're not feisty about it, if there's no consequences, and we're training them, and the debate was a good example in some ways. We have, as an electorate, not just Zoomers, not just seniors, have trained the politicians very well to say, every 4 years we expect to see these platitudes, and we've trained them that there's no accountability and it's just the platitudes, and they've learned what they need to say to not offend anybody. They've learned which boxes to check. And if we don't keep the pressure on before and after, then we're just training them to be unresponsive.
Yeah. Anthony, can I just mention affordable housing? When we devised our list here, we put that first on our list. We should be aware that housing is one of the basic needs of everyone. So if you're not providing a good state in that area, that's going to affect everything else in your population in your country. We have 40 years ago, when I was doing the nurse practitioner program at McMaster, they talked about, and the role of a nurse practitioner was to do the education and the teaching, the prevention element. So what they were saying then was the government never respects prevention. You know, it always looks better for the politician to put huge dollars into a hospital, huge building processes. Goodness, it's a great picture op.
I said you can't cut a ribbon in front of prevention.
Exactly. So all of these things, you know, come down to prevention, good housing, wonderful areas to work, you know, to get the fulfillment in your life, the excitement, the economic return. It all comes down to, you know, like we get so focused on one thing, but it's the whole thing that needs a revision. And they're doing that with police. They're doing that with so many areas at once, you know, and it all comes down to the same thing in my mind.
Housing, I think, got a bit of attention last night. Different points of view from Doug Ford and the Conservatives. It was build. And then from the other parties, it was talking about removing or introducing rent controls or improving rent controls on existing stock. So each party coming at it from a different way. But I thought Mike Schreiner made a good point on behalf of the Green Party when he said that poverty and access to affordable housing were precipitated increased healthcare costs. Yes. So look, and I think looking from the seniors' point of view or through our lens of our members, prevention, not necessarily related to poverty or housing, but prevention in general is a great way to tackle healthcare. And David, we've made two.
And then,
Go ahead.
Yeah, I wanted to pick up on a point though that Beverly made that we should all be aware of too, is that don't forget the entire healthcare system was designed when nobody lived much past the age of 70, and it's not. Many people have said this, not me. I wish I'd thought of it. It's a clever phrase. We don't have a health system. We have a healthcare system. We have a sick care system.
Exactly.
You get sick, you go to the doctor. The doctor is God. God pronounces. You get fixed, and then you don't go to the doctor till the next time you're sick. But that is changing, and I want to. Maybe optimism, but the climate is changing. First of all, there are many models now from around the world about how prevention and wellness are driving down healthcare costs and improving outcomes. So it's now being measured that if I have that many more people that we know, for example, 300,000 deaths in North America every year, 300,000 deaths a year, and I'm sure Beverly knows this way better than me, 300,000 deaths a year could be prevented by fall prevention. If you just stop people from falling, they got older, just that one thing. So that goes back to fitness, that goes back to core strength. But these metrics are becoming known. Second thing is, we know this from our experience with Zoomer Media, our age group now, below 70, say 75 and under, are baby boomers, and baby boomers are much more interested as a generation in prevention, in wellness. We index very high for reading the nutritional content of food labels, for trying to follow a healthy diet. I'm not saying succeeding, but trying to follow a healthy diet. There's a website called Patients Like Me, which has interactive discussion among patients on how to manage chronic conditions online. Got 50 million members covering 2,000 conditions. So our age group is starting to take the law into our own hands much more than our parents and grandparents, who were kind of passively receiving whatever the system gave out, and we didn't have a say. But now this generation is a little bit more impatient. We're not going to accept bad outcomes. So I think the climate for what Beverly's advocating here is better than it was if we push for it. That's all I'm saying. The environment's a little bit more favorable toward that. And the government's realizing we can't afford the sick care model anymore. We're going to get inundated. So we better start paying attention to prevention.
Two of the specific asks that CARP has in our CARP 5 are preventative measures. One is improved access and funding for vaccinations. And we've seen the success of a massive vaccination campaign across the country for COVID-19. But we're also advocating for ease of access and funding for the big three: influenza, shingles, and pneumonia. Vaccinations are on everyone's mind, but the government doesn't always see the cost benefit, David, of that prevention, when again you can't cut ribbons in front of a vaccine order.
It's true, but you can save money, and you can, especially if you produce better outcomes for less cost.
Yeah.
And also if you have,
and they're all scared to death now. They're scared to death about it.
Sorry, I think we had a delay with David.
But yeah, you're exactly right. But no, you're exactly right though. But they're scared to death. See, they're all afraid, all of them. Oh my gosh, we've got this cost avalanche coming at us as people get older. And when StatsCan a couple of weeks ago came out with that thing that the 85 plus population was going to triple, they're terrified. And if you want to get a good sneak preview of what's coming, look at Japan. With the oldest country in the world, the highest percentage. One of the things they did, and I was very amazed that nobody thought of mentioning this among the four parties, because it would have been a very innovative step, but Japan did this, as did Korea. They brought in public long-term care insurance. So they said, let's set up an insurance plan for long-term care. And right now you can buy private insurance in Ontario, you can buy long-term care insurance. So that at a certain age in the future, you've got a lump sum that you can spend on home care or institutional care. They brought in public long-term care insurance as a way of getting ready for this cost avalanche. So all governments are starting to pay. It's beginning to a bit of a hot buzzword in the profession, in the bureaucracy, about how can we improve outcomes for lower costs. And if they can do that, they can say, we reduce the number of deaths, we increase longevity, we reduce wait times. We reduce wait times if not as many people are sick.
And reduce costs, of course.
And reduce costs. So I think the timing is right for us to start making more noise about this. I'm not saying it'll happen overnight, but they are very afraid of the math. The arithmetic is terrifying them.
Just as an anecdote from my own family on the vaccination access, my dad was recommended the pneumonia vaccine by his family doctor. He turned 80, he's got some other conditions, and it was off with the prescription back to his pharmacy. Pharmacist explained, well, I don't have it in stock, but I'll get it for you. And then you have to take this syringe or this vial back to the doctor's office, have another appointment that OHIP will have to pay the cost of for the pharmacist, for the family doctor to inject his pneumonia vaccine. Not only that, he had to pay for it out of pocket. So CARP members have always told us that if the healthcare system isn't actually covering those costs, it's more of a nice to have than something that they really need. So this campaign for improved access to vaccinations for shingles, pneumonia, and the higher dose influenza shot, I think, David, the data can show and lead the way for the
but
decision makers.
In the meantime, they're still exchanging prescriptions by fax machine. I mean, we're so far behind here that it's pathetic. We're like a third world emerging nation or something.
Healthcare has been terrified of the security related to email. I think that's starting.
I understand that.
The Japanese also came up with robots that will help with personal care in the home.
Sure. But e-health is exploding everywhere with very robust security protocols. It's like our government thinks that it's 1980 or something.
Some jurisdictions are getting there. I know that our chapter in the Collingwood area was instrumental in pushing for e-health, and almost every doctor, pharmacy, healthcare provider in that Georgian Bay Area are connected now. Kathy, the Ottawa chapter has been very vocal proponents of fall prevention and the reducing the risk of falls. That's another important aspect of prevention for CARP members.
Absolutely. Well, David mentioned that the number 300, was it 300,000 or something?
Yeah.
It's
annually.
Yeah, and I think most people don't have any idea. We all know people who have fallen, but particularly if you're older, if you have a serious fall and need to be admitted to hospital, that's often in a downward spiral. And
Yeah.
so it's very, very expensive, and it's very, very tough for individuals and families.
Personal for us, David, we had a colleague who passed away from an unexpected fall in his home, a CARP employee years ago. And it's just completely shocking and unexpected. And it's something that generally is preventable. So important there. And the last of the five, David, on prevention is funding seniors fitness programs. We're looking for a $100 per month or a $1,200 per year senior fitness tax credit, refundable tax credit, that will encourage older adults to engage in fitness activities, to continue in fitness activities without really having to worry about whether they're taking money out of their daily budget for something that may be considered frivolous, but is really a necessity in life.
It's a necessity, but it's also being pursued more actively by some. So why not make it more available to all? And this goes to the issue of they're stuck in a mode of thinking. It's not evil, it's just obsolete, that when you hit 65, you retire. Let's just look at the mode we grew up with our parents and grandparents. Age 65, you retire, and you've got maybe 10 years to go. So 40 years of working to produce enough money to cover 10 years, and then it's over. And so your financial planning, the healthcare system, the number of resources, everything is predicated on that. Now, all of a sudden, didn't happen all of a sudden, but they're waking up to it all of a sudden. When you hit 65, you may have 20 or 30 years to go. Fastest growing age group in Canada are centenarians. So who's got enough money for that? So right away, the whole financial planning thing is upside down. Fitness, wellness, the new breed, if you will, us of seniors, are saying, I want to keep fit, I want to stay exercising, I want to, the 63,000 Canadians over the age of 70 still play ice hockey in a league. I'm not saying that they could win the Stanley Cup for the Leafs, but they're in. So if they only opened up their eyes and said, let's fund this, let's tell the recreation programs and the community centers to have seniors programs and not just for young people, let's make it worth their while. It's already a trend. I'm saying with no funding, it's already happening, with no encouragement.
But we do see,
encourage it. Let's go after it and make it even better, because that will also pay dividends.
But we do see that municipalities are not necessarily planning for the current and future demographics of their communities. They're still focused on what they learned in college and single younger families and providing.
They're stuck in an exactly, and it all traces back to, in fact, I hate to say the word, it's ageism. It's an obsolete model of who is doing the aging, which is us, how we are aging, what we need, what we want, how our behaviors are different than the relatively passive, grateful for any crumbs generations that came before us. When they hit that age, they weren't that aggressive. Whatever the systems got from me, I guess I got no choice. Now we see you've got a 20 or 30 year runway ahead of you. You're not going to sit back and wait for them to figure it out.
David, Maria had her hand up, so I wanted to ask Maria if she had a question or a point to make about the debate. Maria, we've got you there now.
Yes, I was just answering your last question by saying that federal and provincial grants, if you go on the senior minister's website, there are lots of free exercises which are run by community hubs and by senior groups and so on. And I know here in Etobicoke, we have quite a few people that have signed up. What I wanted to say is, because I was particularly looking for home care from the debates yesterday, but using my networks, I talked to a couple of communication strategists prior, and what they were saying is that the debaters were told to use numbers, so hence the numbers of long-term care beds rather than what the strategy is for providing home care. And I'm particularly going to be interested in our two town halls that have been set up already, one for Lakeshore tonight and one for Etobicoke Senior tomorrow, to see what is happening, given that we have the most number of seniors in Ontario. And our local media has picked up on that, and they put it in Toronto.com and also in our local papers. So it'll be interesting to see what happens there. But the strategy also, going back to David's comment about PCs not responding, I heard a rumor that, how shall I put it to be diplomatic? If you're not there, nobody can say anything.
Well, I think that's what I was trying to get across last time, that you can't make a mistake if you're not recorded. So
You're absolutely right, Anthony. And I did hear it from a couple of strategists. So
yeah, we've seen it in the past. I think we're hearing it. It may be part of multiple different
and
campaigns.
one last comment: if you noticed Doug Ford's body language, it was not embracive. He rolled his eyes. He looked away. And I heard commentary last night from various folks on the radio rather than the TV. And it was picked up that, like, I know I'm doing well and I'm kind of bored.
Well, I don't think anyone's mind was changed last night by the performances. If you were a fan of the Premier, you likely remain one. And if you were a Liberal voter, perhaps you were introduced to Mr. Del Duca for the first time, but have already that connection, and the NDP and the Greens alike.
One last comment, Anthony, and that is concerning the defacing of the signs that have been in the Greater Toronto area. What people are upset about is that no one last night said anything about, well, yeah, actually they did. I think it was a couple of them did mention.
Maria, sorry, can I I'm not sure what you're talking about with the defacing of signs. Can you tell me specifically what you mean?
Well, what is happening is that the opposite, they're thinking.
Oh, the election signs.
Yes, the
I
election
apologize.
signs. I'm sorry. Yeah, because they've been badly defaced in the Greater Toronto area. And it was hinted at yesterday's debate that what we're not doing in the present timetable is collaborating, and when it comes to big decisions, and I think Schreier picked up on it, and he said, you know, we don't talk to each other when it comes to a big problem, and that's being picked up by people.
Yeah, thanks, Maria. I know that election sign defacing has been an ongoing issue through campaigns, whether it's vengeful anti or partisan attacks, or if it's
becoming personal, which is not professional, and it doesn't indicate that people have a strategy and what they're going to work on.
Yeah, you know? I'm not certain it's campaign versus campaign, but definitely the individuals involved to be pursued by the police and authorities. Inga, you had a question in your hand up. Welcome your comments.
Yeah, I actually work in long-term care as a chaplain. And so what's been happening, of course, during the pandemic is that the way I provided care, especially church services, changed dramatically. Okay. And things are very slowly going back to normal again. Well, normal in quotation marks. I happened to mention to a staff member on the manager of the maintenance department about the kind of costs that would be involved in fixing the problems in long-term care. And his thought was, long-term care doesn't need any more money because the province has poured thousands of dollars into long-term care during the pandemic, making sure, belatedly, mind you, that they all had PPE. And in our place and others, we've received from the province a gazillion of these really, really expensive air cleaners to produce, to get better airflow and so on. So it's, it really depends who you talk to. But as I'm looking ahead and I hear the talk about home care, improving home care, and believe me that I want that for myself, because I want to age in place. I do not want to end up in long-term care. Thank you. But it does mean that long-term care is going to change. If home care improves to that point that nobody will need to be in a long-term care facility unless they absolutely need that 24-hour care, it's going to change because it will increase the acuity level of the care. That's already increasing. We already notice that there are more, and I think it's because of waiting lists, really, that the acuity level is increasing. It changes the way we do activities and things. And so as we talk about fixing long-term care today, are we looking ahead to what the long-term care needs will be in the future? Because they are going to change.
Kathy, do you want to comment on Inga's point of view from the front lines?
Yeah, sure. And I mean, I think this is something we've heard quite a bit, but our view is, and certainly from my understanding and my experience, is that the majority of people in long-term care homes need to be there, or they wouldn't be there. As you said, Inga, nobody wants to go to long-term care. So they, if you have an advancing dementia, or if you have a chronic complex condition that requires 24/7 care, and it does, these folks will need long-term care. And the numbers of people with dementia is projected to still increase dramatically as our population ages. And so if we have all those increased people who are over 80, this is going to become a critical need. So I think this is what we're pushing for, is let's make long-term care a place where people are okay to go, where they can be well treated and respected, and where it can be more like a home. It is called a long-term care home after all, and that's what we should be pushing. And then just for those who need it, because there will always be that need.
I think also, if I can just quickly, I see we have some other questions, but it's a question of what the absolute numbers are. There's 900,000 Canadians over the age of 85 today, and in 25 years, there'll be 2.7 million. So even with all and I think it's important to understand that long-term care and home care are not either or. You are, I think, as Kathy says, you're going to need both. By all means, age in place. By all means, most Canadians age in place. Inadequately, perhaps, could use better services for sure. Systems too complicated to get home care workers in there, definitely. Huge improvements need to be in home care, but it's not either or. You're always going to have that sliver of people who are, whether it's dementia or whatever, they need acute care, they need that, and that's where the butterfly model, the emotional care, as long as you're going to have long-term care, it must be way better than today. You really need to attack both. It's a big topic. It's not, one or the other.
Thanks, David and Kathy, and for the question from Maria and Inga. Doreen, I have you with the next comment.
Hi, folks. Thanks very much. I really totally agree with all of what you said, particularly David. I'm one of the people where we invited the candidates, and the PC candidate couldn't get hold of them, didn't show up. But here's the thing is, in our meeting, we noticed that we know what the issues are, and the issues, they all have the same solutions, basically. My question to them was, whoever gets in, who's going to be able to convince the other parties to cooperate to move forward?
Well, in a majority situation that we've had for the last 4 years, the government could have imposed policies and spending and directed resolutions to any issue they cared to put their mind to. David, CARP is calling on our members to hold their vote close to their chest, and if whatever party that connects with them the most to speak to that local candidate and say, listen, along with all the other things that I support you with, I need you to commit to these important changes to long-term care and healthcare and home care. So what's our message? And I think we're getting close to the end of our time here. What's our message to the current CARP member listening today who watches this video in the future on what they can do in the next 2 weeks and 2 days to really get their preferred candidate to focus on these issues?
Well, I think it's a question of who will declare for the CARP, but who will say, I'm going to do this and I'm willing to be measured by this. But also, we are going to be very active in the post-election. And don't assume, by the way, that if an incumbent wins, any party, if the incumbent took your vote for granted and didn't show up, vote for somebody else, because we have a plan after the election to make it very clear to all three parties where an incumbent lost votes. So the Conservatives or the Liberals, or they may win a seat, but believe me, they're going to do postmortems after the election and say, wait a minute, we had 15,000 votes here last time. We only had 12,000 this time because the seniors abandoned us. Even if we still held the seat, they're going to be worried about that. So we need to send them a signal that if they take our vote for granted and they don't acknowledge these issues, we will not vote for them. We will cross over. We will vote for somebody else. We need to get their attention. And the only way to get their attention is by scaring them at the ballot box. And maybe they'll hold a seat, but they used to have a 5,000 majority. This time it's going to be a 2,000 majority. So they'll get a little bit worried about that. And believe me, we are going to do a riding by riding post analysis and let them know where they lost ground among our age group particularly.
And Kathy, what candidate wouldn't be supportive of transforming healthcare? How is there an argument otherwise? Transforming long-term care.
No, and I think that the one meeting that I recall where we were talking about that, and it was actually a Liberal incumbent, and he was saying that yes, they would certainly support moving to emotion-based care, but it's just they're looking at a whole shift, as you probably heard from the scene in their platform, to go home care first, and then they want to eliminate all the private homes by 2028 and so on. So it's, I think there's nobody who disagrees. It's just not making it a priority. It's just saying, yes, this is what we will do. Just one quick point too. I was made aware this morning that there was another public opinion piece in the Hamilton Spectator from the Ontario Association of Councils on Aging calling for transformation of long-term care, and also for their really pushing for the recommendations of the Commission, for those recommendations to be implemented. So I think we have an ally there.
Yeah, our voice is definitely not a lone wolf or in the wilderness. There are numerous like-minded stakeholder groups, but as a massive voting bloc, I think we can make the difference. So I think I'll end by saying thank you very much to Kathy. We've lost Bev already, but thanks to Kathy in Ottawa, Bev in Quinte West, David Kravitz here at the Zoomerplex, and thanks for your time this morning. I encourage everyone to hold your candidates accountable. Get this message out to them between now and Election Day. The polls are open at your returning office, so if you want to get out early, advance voting's coming soon, and Election Day is Thursday, June the 2nd. Encourage everyone to get engaged with your candidates and make your vote count. Thank you very much to everyone for joining us for our call this morning.
Nice to see you again, Kathy.
Thank you.
We'll keep in touch in the next 2 weeks, and we'll see you. We'll see you on the
Send me the names of those non-attendees, and
Yes, will do.
see if I can mention a few of them on the radio to their detriment.
Thanks all.
All right, take care.
Okay, thank you.
Bye-bye.